Hello and welcome to Healthline 3. I'm Terri Simmons. Today we're talking with Dr. Mark Brown of Pediatric Surgical Associates. He's with Willis-Knighton South. We're going to be talking about treating hernias in children today, and we'll be taking your calls throughout the show. As a reminder, please make sure you're in a quiet room with your TV turned down to a low volume when you call in, just so we can hear your questions. And the number to call is 318-219-4569, and throughout the show you'll see that at the bottom of your screen. So thank you so much for joining us, Dr. Brown.
Well, thank you for having me.
Sure. It's a wonderful topic. It's very interesting, and we haven't talked a lot about pediatric surgery or anything in a while, so it's very nice to have you here today. And we're talking in particular about hernias, right?
Right.
Okay, so what exactly is a hernia?
So a hernia is basically a hole or an area of weakness in a muscle somewhere. And there are many different types of hernias depending on where they're located anatomically. The most common hernia that when people think about having a hernia is an inguinal hernia, which is in the groin. But you can have them, they're very common in the umbilicus or in the belly button, but they can be in multiple other places. For instance, people who've had a surgical incision can have a hernia in that incision, and that's called a ventral hernia. So there's a lot of different types of hernias that kids get.
Okay, and I love that you've brought up these videos for us, and you brought us some nice graphics kind of explain that. And that one we just showed talked about what you just talked about, the different types of where they can be found. Mm-hmm. Now here on this graphic, this is the different types of hernias that we can find, right? You want to talk about each one and where they're located, like the inguinal, where is that?
Right, so an inguinal hernia is much more common in boys, and that's really when people think of a hernia, I think that's probably the traditional idea or thought of the type of hernia that people think about when they hear, I've got a hernia, or this person has a hernia. Again, it's much more common in boys than girls, and that just has to do with the way the anatomy forms and when they're developing, because almost all hernias in children are hernias that are formed, that develop before they're born, basically, in evolution, or when they're embryo and developing. So an inguinal hernia is down in the groin, and it usually presents as a lump that comes and goes. And so when a parent or a family comes and asks me, I think my child has a hernia, the first question I ask them literally is it a lump that big that comes and goes? And if they say yes, I say, you're right, you've got a hernia. If they say no, I say, well, maybe we better check it out a little bit. And obviously you have to do the whole process of an examination, and occasionally we'll do some imaging studies, although in children, taking x-rays and that kind of thing is much less common and much less necessary than it would be in an adult. So anyway, so that's the inguinal hernia.
Okay, and we can put that graphic back up again because we're going to go through all of the different ones on that graphic. Okay, so that's the inguinal. Yeah,
probably the next one is an umbilical hernia, I would guess.
Yeah, okay, we can go through them. Yeah.
And an umbilical hernia is just a hernia in the belly button. We call the belly button the umbilicus or the umbilicus, and umbilical hernias are very common. If you think about it, the umbilical cord goes through where your belly button is, and there's 3 blood vessels that go through that. So in every child that's born, there's a hole in the muscle, because if there wasn't a hole, those blood vessels couldn't get through from the mother to the baby. So everyone, when they're very first born, has a hernia. It's just that some of them are so small you really can't tell, and some of them close up very quickly. But the basic rule on umbilical hernias in children is about 85% of those will close on their own by the time they're 4 years of age. Oh. So unless it's really large or they're having some issue with symptoms, we tend to try to when we see them when they're younger, we tend to try to follow them over time, and a lot of times we'll measure them and then see if they just decrease in size or will go away on their own. And many times those hernias will go away on their own. And people, it's very common, they'll come to you and they'll say, this is, it looks really big, it's not going to go away. I'm like, Well, actually, it probably will.
Yeah.
If you just are patient and if they're not having, significant problems from it.
And that's really interesting that it'll go away. Does that mean the muscle will actually seal and heal, and
Right. So
the tear will heal itself?
right, and
Wow.
how that works is really not well understood, but it is an undeniable fact. And like I said, everyone has a hole there in their belly button by definition because there's stuff that goes through it. But a lot of times when they're born, they're not that big. But so everybody's tightens up and it scars in and heals up. And I said about 15% of them, of children who are born with an umbilical hernia, it won't close by the time they're 4. And that's typically the time that if they don't close on their own, then we'll repair them.
You don't think about the belly button. I mean, you notice people have different belly buttons, but you never think about really the usefulness and what we have.
Well,
what goes on with it.
Right. When I was a kid, for whatever reason, and I don't know if it's still a thing, but it was, we'd go to the swimming pool. It was like, do you have an innie or an outie?
Innie or an outie, that's right.
So turns out an outie is an umbilical hernia.
Really?
Yeah, pretty much. I mean, it has to change with time a little bit. Sometimes people just have some skin that's thickened and has some scarring on it, or that just kind of sticks out. So if it never changes, it's probably not a hernia. But if you have an outie belly button that comes and goes a little bit, that is a hernia.
Okay. And would that need to be addressed? I mean,
so it does need to be addressed if they're older. Now, if it's a 1-year-old, what we do is we see them in the office and we identify the problem, and then in those cases we'll observe them. And I might see them once a year or something like that, as long as they're not having any significant problems from it. And most of them don't have problems from it. So as long as they're not having a problem, we'll see them once a year until they close, or around 4 years of age. If they don't close on their own, then we will typically do surgery to repair it.
Okay.
And that's, for whatever reason, that's when they stop closing on their own. I mean, it's pretty well studied, and people know that at 4, they just quit closing for whatever reason.
For whatever reason. It's so
Right.
interesting how it works.
Right.
Yeah. So what's another type?
So there's people who've had surgery can have an incisional hernia in the scar, and that's really a different thing. I mean, that's the other hernias that we've talked about so far. You're really typically born with them. An incisional hernia or a hernia after surgery is just a lack of healing. And for instance, if you had an abdominal operation and the muscle for some reason didn't heal correctly and there was a small gap, usually it'll be a small gap, then that's what a hernia is, or that's an incisional hernia. And incisional hernias in children are somewhat unique in that if you have an incisional hernia in an adult, you can pretty much say it will never heal. There is an exception in children. If you have a child who's under a year of age, typically they've had surgery when they were an infant, like in the NICU or something like that. Some of those will actually heal up on their own. And we typically, a lot of times, if they're not having problems from it, I'll give them up to a year and see if those will close on their own. And then if they don't, then they would require surgery.
Okay. And is there another type of hernia?
So there's another type is a femoral hernia, which is kind of down in the groin also, but it comes down lower than the typical inguinal hernia. So those are fairly rare, more common in girls, but again, they do require surgical correction. There's another type of hernia that is kind of on the outside of the abdominal wall, or on the what we call lateral. So not in the middle, but more on the outer part. That's called a Spigelian hernia. And again, that's a relatively unusual type, but we do see those also.
Okay. Are there any that are worse for you than others?
Well, so the inguinal hernias, I think, are worse than the umbilical hernias. And the reason that they're worse is they have a much higher rate of complications or problems. So that picture right there is an inguinal hernia. And what the problem that you can have in general with hernias is it's a hole in the muscle, and the intestine that's inside of that envelope of the muscle, the intestines are kind of like a bunch of spaghetti or something. They kind of wiggle around, and they can get into that hole. And as long as they go into that hole and then they come back out, it's really not a huge deal. But occasionally they'll go into the hole and get stuck. And when that happens, there's, you have the arteries that pump the blood into the intestine and the veins that take the blood away from it. And what can happen is the arteries are a high pressure system, so the blood can keep going in, but the veins get kinked off at a much lower pressure, so the blood can go in and it can't get out, and they swell. And then that leads to a cycle that can be a serious medical emergency, which we call incarceration. And that's like when the hernia is stuck, when the intestines are stuck in the hernia, and that's called incarceration.
Okay. You want to look at your next graphic? Let's see what we have here. Maybe we can talk about
and
that.
there's one more comment I have about that on the incarceration issue. So that becomes an emergency, and that's really, if you looked at the causes for intestinal obstructions in 1890, hernia was probably the most common cause.
Wow.
If you look at it now, it's about 10 down or 12 down the list. And the reason it's 10 or 12 down the list is because now we fix them before people ever have a problem with them. So it's really, repairing a hernia is a preventative. It's kind of like preventing a problem that is likely to occur in the future.
Okay. And can it be a slow tear, a slow thing, or is it like you rip something, you feel like you've ripped something, you've got a hernia, or how does it come about?
So in kids, most of them, they're born with them. So they're there. But it's interesting, they may not show up, or you may not see them for several years after they're born. That's not uncommon for a 2-year-old or a 4-year-old to show up in our office and say, well, we've got a hernia, they've noticed it, and how long has that been going on? 2 months. Well, they were born with it. It's just for whatever reason the intestines were not popping through that hole earlier on, and somehow as growth occurred, it changed and became easier for the intestines to kind of get down in that hernia.
Okay. So do they not show any other symptoms? Is it up to the parent to kind of just know their child's body and makeup well, or there's something to look for in the way they act or their illness?
So in babies, the most common time that someone identifies a hernia is they're changing the baby's diaper and they notice a lump that comes and goes, or they notice a lump and they think it's unusual, and then they'll go to their pediatrician or to a doctor, or sometimes directly to us, and then the diagnosis is made. But that's typically, it's the parents notice a lump that they find it unusual. And mothers are really good at finding lumps. They are, it's amazing
We are.
how good mothers are at finding lumps, because sometimes they'll say, oh, there's a lump there, and I have to look about 5 minutes, and I go, oh yeah, okay, I found it. So
We are, and we're also good at like feeling around and poking at it. Now, is that dangerous? If we're like, what is this? Does this hurt? Can we hurt something by pushing on something, on a hernia or something that's kind of protruding through the hernia? Could we hurt our child?
No, unlikely that you would cause any significant permanent damage. I think you're safe on that one. But and in fact, when a hernia in the groin gets stuck out, which we call incarceration, you either have to emergently repair that, or you have to what we call reduce it, which is to push it back in. And when we do that reduce that hernia, sometimes we have to push pretty hard to get it to go back in.
Okay.
But if you can get it reduced, then it's no longer an emergent surgery. We would typically, when that happens, we would, if they're in the emergency room, say, we would admit them and do them the next day typically, but we wouldn't do them in the middle of the night.
Okay. All right. So not too much, not a panic, not an extreme. This has to be taken care of right now, right away.
Right, unless if it does get where the intestines is stuck in the hernia and it won't go back, and I always ask people, when I'm talking to them, I say, well, has it been stuck out more than an hour? That's kind of my number, is an hour. Or I tell them, when I'm telling them what to look for, I say, if it sticks out more than an hour and you can't push it back in, you need to call us.
Okay.
So that's kind of my number, is an hour, because you really have about 4 to 6 hours before serious problems occur. But I want the families to know, if it's been an hour, you really need to call us, and we need to start the process moving of getting it looked at and figuring it out.
Take it seriously.
When that happens, then your intestines are kind of pinched off, and so you have an intestinal obstruction. So people have crampy abdominal pain oftentimes, and oftentimes they vomit.
Okay. All right. We have a Gary on the line for you. Gary, what is your question for Dr. Brown?
Hi, thank you for taking my call. Dr. Brown, I had injury in the Navy back in '77 in Hawaii. I was in the submarine service. And like you were just talking about, the intestine went through the chair, and they rushed me to the clinic there at the base there in Hawaii, there at Pearl Harbor. And the doctor pushed the intestine back through the chair, and they rushed me to Tripler Army Hospital, and they put this mesh where the injury was. And now I'm 65 years old now, and now it's like I'm starting to get like swelling and tenderness, and so I just wanted to get your input on this.
Right. And where was that injury? Where was the hernia exactly?
My gut on the right side, lower.
In your groin?
Yes, sir.
Yeah.
Yes, sir.
Okay.
I was lifting heavy weights, in the sub, and I ended up getting the injury. And like my fellow comrades there in the boat, rushed me to the clinic there at Pearl, and then they rushed me to Tripler Army Hospital, and they did the surgery on it. And this was back in '77.
Right.
So it's lasted a long time, the repairing the injury. And it's like, well, maybe the mesh is tearing, and so it's, I'm starting to get the swelling every now and then and tenderness. And
Right. So in that case, what you should get an evaluation, and probably the simplest thing is go to your regular doctor and explain the situation, and they would check it out, and they might want to send you to a surgeon to evaluate it, and they might want to do certain imaging studies to evaluate that. You bring up a point that is important to note. You had your surgery when you were an adult, and you had mesh put in there. Mesh is very common in adults' surgery, and in fact, I think most of the adult hernias that are repaired are repaired with mesh, so it's very common. And that's the exact opposite with children that we deal with. We almost never use mesh in children, and the reason is mesh is great for adults because you put it in, the adults don't grow, they stay the same size. But if you put mesh in a child, the child grows, but the mesh stays the same, and that can lead to the mesh separating or tearing or causing problems. So we almost never use mesh in children, but in adults it's very common. And like I said, you definitely need to get an evaluation and have a doctor or your regular doctor or a surgeon look at that.
yes, sir. Thank you so much.
You're welcome.
Thank you so much for calling, Gary. We wish you well. And again, Dr. Brown, that was a great call and brings up so much good to compare between adults and children. So besides the fact that children are still growing, what is the difference in the surgeries that you do on an adult as opposed to a child?
Well, the principles many times are the same. But people think, well, children are, because they're small, they don't tolerate surgery well, or they might have issues, or they're worried about them having an issue with the surgery because they're younger or smaller. It's really the exact opposite. children are much more flexible, much more pliable, and tolerate surgery much better than adults. And I guess maybe if you think about it, when you were 10, you could go out and run around all day and you didn't even notice it. Now if I go run around all day, I do notice it. So but really children are very they tolerate surgery very well. They're just they're healing machines. They're great patients, and they do very well with surgery.
They do. They just seem so much more resilient.
Right.
Whether they have that natural help already, they haven't been exposed to a lot that an adult has.
Right.
Not only culture and conditioning and habits. That's my view too, so it's nice to hear you say that.
Right.
It just feels like they would be stronger and quicker to heal. Is that true?
Yeah, it's interesting. I always say, well, kids are much more flexible than adults, and for whatever reason, it just we actually do a lot of multimodal pain treatment for surgeries. So when we do surgery on kids, we typically have 2 or 3 modalities of treatment that we use for the pain that they have with the surgery, and it just works great. They seem to have so much less pain than adults. Part of it is just the child is very flexible and that they have less pain, and then part of it is just the kind of multimodal treatments that we use for their pain, and we try to minimize the narcotics and do all sorts of blocks and so forth that really make it a lot easier on them.
Okay. And do you find that the parents are the one thing that's so hard as a parent to see and think about your child? So any viewers who are watching or have children who are thinking about this and listening closely, if they have hernias or any other kind of surgery, it's so heartbreaking and scary to see your child being carried off to surgery.
Right.
So what exactly happens during surgery for a hernia?
So the first step in surgery is obviously take them from the holding room where they're with their parents back to the operating room. And if they're really young, then they don't necessarily get some medicine to relax them. But as you can imagine, once kids become 3 or 4, they can be very resistant to separating from their parents. So a lot of times they'll get a little medicine that they drink, a tiny little amount of medicine that they drink that kind of relaxes them and makes them forget what happened. So they don't really have these scary memories or whatever. Okay. So then you take them back to the operating room, and then they go to sleep. And once they're asleep, then if there's some sort of, if we're going to do one of these blocks that the anesthesiologists do, then they go ahead and do that usually before the surgery, because it's better to block any kind of pain before it ever starts than to try to catch up after it's occurred. Once that's done, then we do what we call a prepping and draping, where we use special solutions that kill all the bacteria and clean the area very thoroughly. And then we drape it out with all these sterile towels and drapes. And then once we have that, then we have what we call a sterile field, because the whole point is to keep any kind of bacteria out so you don't get an infection. And in fact, the infection rate with hernias is very low, probably in the 2 to 4% range. I mean, it's a low number.
Okay.
So then you do the surgery.
Okay. So we'll talk a little bit about infection rate and recovery, but we have a caller right now. Jean, what is your question for Dr. Brown?
Yes, Dr. Brown. Back in July, I was at a nursing home rehabbing for a knee, and suddenly discovered a hernia one morning. By the time I got a CT about 3 hours later, I guess it popped back in on its own. But I was in such intense pain I couldn't even lean over. I was really scared. However, like 2 months later, another doctor looked at that same CT and said, your bladder was so enlarged, it was probably your bladder popping through the hernia. And I want to know, now I got to deal with not defunctioning bladder, it doesn't function too well. But I want to know, do all hernias need to be repaired? I haven't had any problems since then.
So was your question, do all hernias need to be repaired?
Right. Yeah, it was probably caused to say that my bladder was very enlarged, and so that, you know, I guess there's a hole there, but I want to know, if you're not having problems, does a small hernia need to be repaired?
In general, we do repair most hernias, but all hernias do not need to be repaired. For instance, in an adult, sometimes in a hernia from previous surgery, if it's small and not causing problems, or if their patient has a lot of risk factors that would make surgery more dangerous, then people would not repair those. Like we already talked about, the umbilical hernias in children, and we don't repair those right away, but that's because they oftentimes will go away. If you had an episode where something was stuck in a hernia, then I would definitely get a physician to evaluate that and to follow you for that condition, and make a determination based on your exam, possibly on some imaging studies as to whether it requires repair or not.
Okay. Well, I'm waiting to see a urologist, so, but I know that what happened was, by the time I got to the hospital, it had popped back in, and they couldn't find it on the CT.
Right.
But another doctor looked at it and said it was probably your bladder.
Right, and that can be an issue. Sometimes you can have a hernia and not be able to feel it on exam if there's no intestine or anything popping in or out of it. So it can be sometimes difficult to diagnose a hernia.
Well, I mean, I felt that when it first happened, it was a definite lump, and I went, okay, I have a hernia. But then by the time I got to the hospital, it had fixed itself.
Right, right. And we do, it's not real common that I'll see someone who has a great story for having an inguinal hernia, and you really can't feel anything on the exam. And sometimes the test we do in kids is an ultrasound, and it's not a perfect test. I do it much more often based on physical exam than on the ultrasound. But every once in a while, if we really can't feel much, but the family has a really good story, then we will either explore the area or put a scope in their belly button and look from the inside to see if they have a hernia. So.
All right, thank you.
You're welcome. It is interesting, for instance, in little babies, sometimes in girls, in the NICU that we see, they'll have a hernia, and they can have, it's not uncommon to have an ovary that goes out in the hernia, but you can actually see, I've literally seen the entire uterus and the ovary and tube flip out into a hernia. Yeah.
Wow.
So they do all sorts of weird stuff.
That's amazing.
Right.
Yeah, and in that point of the surgery, is that what you do? You push it back through and place the organs where they're supposed to go, and then sew up the hernia?
You do, but it can be difficult if there's a lot of swelling.
Okay.
That can make it harder.
All right. This has been fascinating. I could talk to you all day, and I really want to thank our viewers for calling in too with such great questions. Is there anything that you'd like to leave us through? We have, one more minute, I think, to talk about. Anything you'd like to leave our viewers with about hernias in children?
I think the main thing is, if you suspect your child has a hernia, then you should go show it to your pediatrician. It's very helpful if it's something that comes and goes, which now with cell phone cameras is easy, is take a picture of it. And many times a patient will come in and you're like, oh, maybe they have a hernia, maybe they don't. You can't always tell on physical exam. Well, then they'll show you a picture, and it's very obvious that is what it is. So if you see a lump, especially if it's not coming out a lot, if you can take a picture of it, it can be very helpful.
Okay, so take a picture of it, call you immediately.
Right.
Don't worry about it. It's not a rush immediate, but definitely no change in an hour. Look at that if you have, like you talked about, if you push it back in or you touch on it, and definitely get to see you and take care of it.
But if it's stuck out and hurts, and especially if they're vomiting, then go to the emergency room.
Come see you. All right. Thank you so much for Dr. Brown. We appreciate this.
All right.
And everyone, thank you again so much for watching us. Enjoy the rest of your day, and we'll see you next time on Healthline 3.